American Heart Month is here, and so is Dr. Lawrence O'Connor. He's an interventional cardiologist with Dignity Health Glendale Memorial Hospital. Good morning. Thanks so much for joining us.
Good morning, Amy. Great to be here. Thank
well,
you.
He's commenting on my blue and yellow because of UCLA. But so we want to talk about some of the differences because this is Heart Health Month, and you know, so often people think it's a men's disease, but you were telling me just in the commercial break that it actually is the #1 killer above breast cancer even for women.
That's true. Yeah.
Yeah.
That's true. Women tend to get heart disease maybe 10 years later than men, but it is #1.
Okay. And what are some of the different warning signs for heart attacks in men and women? They differ.
They
Is
do.
that right?
They do. Men tend to have discomfort in the chest that's pressure-like and central. Women can have pain that's in the abdomen, and so it misleads both the patient and the doctor in terms of trying to solve what's going on. The pain that women experience may be on the sharper side.
Okay.
And so it can be a conundrum. It can be difficult when a woman presents. The other issue for both men and women is that profound fatigue is a very early warning sign that something may be going on with the heart. So we have to listen to our patients and not just focus on pain, but on some of these other symptoms as well, shortness of breath, for example.
What about pain in the back? Some people say that they've had pain in the back. Is that a symptom or just?
So the heart is the engine of the human body, and it's about as big as your fist. It sits here, and like an engine, it has 3 fuel lines. We call them coronary arteries, okay? So if you have an obstruction of this central artery on front, it tends to radiate to the front. But either one of these other 2 may produce pain in the back. And again, you get misled.
What are some of the prevention measures that people can take to prevent heart disease?
Well, the big one is to quit smoking. And then to embrace a Mediterranean lifestyle. And so that means doing 30 minutes of walking a day. It means a Mediterranean-style diet that focuses more on fish than on beef.
Okay.
And trying to get rid of stress.
Easier said than done.
Yeah.
What are some of the newest treatments for heart patients? Because you guys are constantly working on.
We're constantly innovating. And I think the biggest thing is the emergence of the so-called STEMI receiving centers. STEMI is our acronym for acute heart attack.
Oh, okay.
And so throughout Southern California, we now have hospitals that have on call an interventional cardiologist, a cath lab team, and they're there 24/7, 365. And we will take a patient to the cath lab and get their artery open in 90 minutes or less.
Wow.
And these patients then tend to leave the hospital with normal functioning hearts, whereas in the old days, there'd be significant damage and a lot of scar replacing healthy muscle.
Wow. And you all have a big event coming up, the King and Queen event at Dignity Health Glendale Memorial Hospital.
Yeah, this is an annual event we hold in February around Valentine's Day. And it is a get-together of all of the people in our cardiac rehabilitation program. So we have a gala that goes from 10 to 2 on the 15th of February. A lot of vendors, a lot of free testing, and I give my annual State of the Heart address in which I try to summarize everything in 5 minutes or less.
Wow. And so for everybody listening right now, what's the best advice you have for them right now?
In terms of preventing heart disease, put on your shoes, walk 30 minutes a day, quit smoking, follow a Mediterranean diet, which consists of fish, fowl, filet, fruits, fresh vegetables.
I love it. All right, Doctor, thank you so much for joining us.
All right, Amy.
Certainly appreciate it.
Thank you.
And to find out more about Dignity Health's King and Queen of Hearts event, just go to kcal9.com and click Seen on TV.